Hi, I'm David Rapaport, board certified plastic surgeon in New York and also the founder and medical director of Athos. Wanted to talk a little bit about what they call today Ozempic Face. So you're on a GLP-1 like Ozempic or the other products. You're losing weight kind of rapidly. What's going on? What is this Ozempic Face thing? So before I get back to that, to help understand it, let's talk about what happens to the aging face. So the aging face uniformly, but in different spots, but all aging faces lose fat, okay? This face is 66. It has a bunch of filler here, here, here. I'd look much leaner if I didn't have the filler because I'm 66. The other thing the aging face has, and it's different in different people based on your genetics and your sun exposure and other things, is laxity, right? We get loose. So even with my volume, my skin is looser. Now they both reinforce each other, right? Meaning the more you deflate a face, especially when the skin isn't so elastic because it's not 16 anymore. So the deflation, the volume loss increases the laxity. So you have two problems, right? And that helps bring us to Ozempic Face. So what Ozempic Face is, a face that has experienced a lot of weight loss quickly. And so when you deflate a face quickly, you're gonna have both things. You're gonna have a lack of volume in different parts that depend on your genetics and how you were built and how much fat you had where to begin with. So it could be temple, could be the cheek, and this part of the cheek especially can look so kind of hollow in people that have lost a lot of weight. By the way, it's similar in people that are on antiretroviral drugs to keep HIV at bay, because that has a facial atrophy effect, which is fat loss, fat atrophy effect. So anyway, Ozempic Face is a face that has lost volume, that is also suffering from more laxity caused by the volume loss. Now, how we treat that face is like everything else we treat at Athos. It depends on the owner of the face, meaning what are your expectations of improvement? Just a little tweak and you're good to go, or a lot more. Of course, it also depends on your expectations, meaning if you have a saggy, emptying face but have 100 more pounds to lose, versus if you're done and you're plateaued. So all of these things factor in. Suffice it to say that when you have these kind of problems, you generally want to use multimodality, especially if you don't want to rush into surgery. So what does that mean? When you have think of just a pillow, and you take stuffing out of the pillow, what happens? The material looks looser. So you want to, going back to the face, you want to use filler intelligently when it's appropriate for the volume loss. You also want to do tightening as best you can. Now, a facelift is the ultimate tightener because it's restoring tissues to where they came from and removing extra skin, for example. You might get there sooner or later, but before you get there, if that's not where you see yourself going anytime soon, because you're too young and because, let's say, it's just also totally not in your budget, something called Softwave is very helpful. That is a focused ultrasound treatment. It only goes 1.5 millimeters into your skin. So the big risk of treatments like Morpheus, and the reason, even though Morpheus is still very much spoken about, but it's about to fall off a cliff, to be honest. And I'll say it again. Morpheus is falling off a cliff. And the reason it's falling off a cliff is because it's like using a nuclear bomb when you want to light a cigarette. Those needles, when they're going 3 and 4 millimeters deep, are dangerous and they can cause fat loss. That's essentially one of the issues. And the other thing is these needles are going through your skin. And if you can get equal or better skin tightening without violating the skin with needles, well, that's obviously better. Less risk of hyperpigmentation, less risk of a scar, pretty much no risk of a burn. So those are all the reasons that I prefer Softwave. It's, again, more elegantly simple to get to what you want, which is to tighten skin. But nobody should think for a second that even doing 2 or 3 Softwaves is going to give you a facelift. It isn't. It's going to give you some tightening, more for the impending laxity, the laxity that you're causing by losing more weight. It's not going to restore a saggy face. It's just going to improve it somewhat. There's another treatment that is relevant and becoming, I hope, more relevant, and that treatment is called Eloor. I've been performing Eloor for a few years. It's a treatment that uses a different paradigm, meaning a different way of thinking about tightening. So when you look at laxity and you're doing Morpheus, which we do much less of, Softwave, which we do much more of, both treatments are putting energy into the dermis, into the skin, to cause collagen to form, to tighten it, right? Whenever you put heat into tissues, you can have side effects of heat, which could be burns, and which is fat loss if the heat's in the fat and you're fat sensitive. And you don't always know if you're fat sensitive till afterwards. That's what people don't really get yet. So Eloor doesn't use energy. Eloor uses a totally different concept of saying, well, when you do a facelift, in a very simplified way, you're going under the skin, pulling on things and removing skin. Obviously, you're doing more fundamental things to the deeper tissues, but you're removing skin. The genius in Eloor is to say, well, if you remove a teeny, tiny spot of skin, so small that we can show that it will not scar. It's just like when you get your blood drawn. You're not going to get a scar. It's a tiny little cookie cutter little bit of skin you might be removing with suction, which you don't do when you do your blood draw. But the point is, it is well established that when it's, I think, less than 0.4 millimeters in diameter, you're not going to get a scar. So the same guy that invented cool sculpting, someone named Rox Anderson, who's a professor at Harvard, said, well, if I can make a system that is removing, let's say 10,000, let's say 15,000 tiny little dots of skin, when you add it all up, haven't I removed a bunch of skin, so aren't I going to get tightening? And if I do that without energy, doesn't that have much lower risk of all the complications of energy, like fat loss and burns? So that's all true. The struggle with Eloor has been the quality of the coring, and things are happening now to make that much better. Stay tuned. I had the privilege of meeting with the CEO of the company the other day, and I'm very excited about what I'm hearing and learning. So I think that's a technology that you might be hearing more about. Ultimately, though, you have to be realistic in this whole thing. And if you've got these jowls and you're looking at a face like mine and saying, this is terrible, I don't want this shit. I want a clean under neck, and whether you're a woman or a man, and that's your expectation, and then stop with the non-invasive stuff and start thinking seriously about, how do I get my facelift, what facelift with whom, and all that stuff. Because that's the ultimate treatment for lower facial laxity, for all the extra skin and the crepiness, the platysma, which unfortunately even in the best hands does often recur after facelift, something people don't advertise, but it's true. So you might be heading to facelift land. That's another topic, and that's really the next topic we're going to discuss, because I've been doing facelifts for 35 years, something like that. I've done hundreds. I have a lot of experience with them. I have my own experience and then the experience of others, because smart people learn from the mistakes of others. So I've been in this world a while and have quite a bit to say about it.